CALCAREA PHOS. Now you know that this medicine we are using in a biochemic also. Maximum we are using in a 6x potency. But we have to understand the homeopathy mind also of this remedy, because it's very important mental picture with that. So let us CALCAREA PHOS, you know that phosphate of lime. Now this elements oxygen, phosphorus and calcium. Right? Now preparation, the mixture of the basic and other phosphates of lime prepared by dropping dilute phosphoric acid into the lime water. As long as the white precipitate is formed, this precipitate is collected and triturated. Now sphere of action, very interesting of this remedy, important for nutrition, and that is why we generally give this medicine in biochemic 6x potency to all the children, and special children. Definitely we are giving 6x 2 tablet 2 times a day, along with the constitutional and special children like autistic, hyperactive children, right? So the action more on the bones, sutures, periosteum, cartilages, abdomen, text and chest. Now important ailments, we always then thinking when the grief is there, we always think about more emotional remedy like natrum ignatia, but CALCAREA PHOS has also grief and vexation and even disappointment in love. That ailments is also there. So never jump directly on all the common remedy like natrum ignatia, staph aureus. You should think if the other symptoms matches very well, then you have to think about CALCAREA PHOS, especially the bone problems. Anemia is there, then debility after acute disease or a chronic wasting disease. CALCAREA PHOS is a remedy. Constitution wise, as well, we know that the patient, especially school going children, delicate, tall, like phosphorus elements is there. So it's one of the constitution quite match with the phosphorus also. Tall, thin, with a dirty brownish skin. Anemic children, as I told you, who are peevish, flabby and have cold extremities and feeble digestion. Obesity, flabbiness, also cases of emaciation. Now the important is personality of CALCAREA PHOS. If you want to remember CALCAREA PHOS, you have to remember tuberculinum. Now tuberculinum has also a lot of dissatisfaction. CALCAREA PHOS is also tubercular miasms, and we give whenever the tubercular miasm along with the symptoms of CALCAREA PHOS mentality, we give this remedy in a 200 or 1 potency. So these infants are very irritable and needy. Child cries and require constant attention. He wants to be carried, right? Very important. He wants to be carried. You can compare with a chemomina. Irritability is also there, and they also wants to carry, and the better by carry design. So these children cries and require constant attention. So constant attention again the tuberculin trend. So you can compare with the tuberculinum also. They also needs attention, and that is why tuberculinum we are using in a special attention deficit syndrome. Now he feels that something is wrong internally, but cannot put finger on what is that bothering. Sometimes these children cannot tell you that whether it is a pain in the abdomen, pain in the head, or something wrong with the body. They are not able to point out, or they cannot speak also. So this is the remedy when you have this type of symptoms. They are constantly, there is a constant wrong in their body and they cannot be point out. They may have a weakness, they may have a body ache, they may have a pain, but they cannot find out. So this makes him peevish and dissatisfied. Something is wrong with their body. Now at a school age, these children often present with a complaint of school phobias. You know that. School headache, very important, another tuberculinum is there, spularia, right? Especially they are many times complaints about the stomach pain when they don't want to go to the school also. Faint sickness is tuberculinum veretum alvis also there. When they do not want to go, they excuses and they make the pictures like that they have something wrong with their body. So that is one of the things. Overwhelmed by stress of the school, they cannot cope up with the stress of the school, like homework, performances, and that causes the headache or dissatisfaction. Now very sensitive, open and friendly. Very friendly because phosphorus is enhances there. So you can compare with phosphorus, you can compare dissatisfaction level with tuberculinum. Constantly complaining. आज ये हुआ, आज वो हुआ, आज हेडेक है, पेन है, मूड अच्छा नहीं है. Then they getting bored very easily because they need change. There is no satisfaction at one level or at one hobby or at one interest of games. They need constant change, and that's why they bored easily. They have a lot of dissatisfaction. The chronic causelessness feeling of unhappiness and generally bad attitudes. The attitude is also not good because of dissatisfaction, and that's why they bored easily. So, in short, if you have to remember Calcarea phos in a nutshell, you can see dissatisfaction. And if you see in a repertory dissatisfaction, discontented, Calcarea phos is there. You can see. Discontented. So discontented Calcarea phos is Viparsal, tuberculinum, Merxol, Netramune. These are the medicines, right? So if you have to remember Calcarea phos, you have to remember dissatisfaction and that constantly want a change of environment, and that is why they have a desire for traveling. They cannot satisfy with the one place, so they want to explore many things in a short time. So they go one place to another place and desire for traveling because of dissatisfaction. The morning, meaning, and sometimes even during sleep. Even during sleep also morning, meaning, and sometimes even during sleep. Fear or aggravation on hearing bad news. When the bad news, you always we think about the shock is there, we always think about the ignatia. But which are the other remedy? Netramune, Coffea, okay. Coffea is the excess of joy. Good. So fear of thunderstorm and dark, also there in Calcarea phos. So that's all regarding the mind. You have to remember the dissatisfaction, restlessness, and they are constantly bored or easily. Now generality you have to remember delayed development and slow to walk. Delayed dentition or teething problems, delayed closure of frontalis. So whenever the infant patient comes to you, and then you have to check the frontalis, you have to see the scalp up and then just palpate whether the frontalis closer or not. And if you have symptoms of dissatisfaction, restlessness, and other general switches, definitely Calcarea phos can be given as a constitutional remedy. So you can confirm after checking with the frontalis and then all other things. Then craving for sweets, smoked meat, ice cream, salty things. And the last aggravation, change of weather, cold, melting snow, because when the snow is melting, the complaint may start. Many children, mental exertions, loss of fluids, fruits, and thinking about the complaints. Generally worse from drafts. Whenever the drafts aggravation, we always first think of a Hepar, but CALCAREA PHOS is also there. And then emulation by summer, warm, dry atmosphere, lying and passing flatters. Clinically, we use this remedy in many conditions. That is a very important. Not only biochemic 6X you should use. There are arthritis, you can use chronic fatigue syndrome, dentition, depression, diarrhea, headache, piles, cervical spondylosis, obesity and otitis media. These are the conditions which we can use CALCAREA PHOS. Constitution is there or mental picture is there. You can give as an interval. Alright.